Good morning and welcome to COVID-19 Talk with Local Health Authorities. We have a new health authority that's joining us this morning from Harris County, Dr. Janina White. Welcome, Dr. White. And with us representing the city of Houston, Dr. David Peirce. Thank you, Morgan Ash, for being our producer. And we want to thank past President Kathy Fenninger for providing these questions. We apologize for the delay, but we had some technical issues, which we seem to have every week or so. But let's get right to it. Vaccines. DSHS shows Harris County has 53.3% with at least one vaccine and 41.7% fully vaccinated. This is certainly higher than the national average, though not as good as many other states. Is that calculated as a percent of the entire population or those eligible to be vaccinated?
Good morning, Stephen and everyone. Thank you. This is Janina with Harris County Public Health, and those are actually of those eligible to take the vaccine.
With new approvals, that number will increase. But when the mask mandate was lifted in Texas, many thought it would cause a huge surge. To what do you attribute what some call a non-event?
And I think that the person with the question is right. It did turn out to be a non-event, and there was a lot of concern that the lifting of the mask mandate was going to cause another, and we had every reason to expect that, because every time we had seen in the past when precautions were lifted that we saw a surge following it, but we didn't this time. And the one thing that is different this time than the previous times is the presence of vaccine, and vaccine is absolutely our way out of this. And so what you're seeing in the non-event isn't that the virus has gone away or that this never was an issue. It's that the vaccine works and that people are getting vaccinated. Our issue today is we need more people to get vaccinated. That's why we still have people getting hospitalized every day.
People, it just wasn't because we were just making it up. It is because vaccine is out there and in people's arms. Any idea how the vaccine distribution is going in the 12 to 15-year age group and whether the side effects mirror other age brackets?
We are excited. Our early adolescent, 12 to 15, have been getting vaccinated. We have been doing some great coordination with schools and partnerships with some of our area hospitals who have been real receptive to work with what we call small school pods in a way, and the city also is working on that. Our young people understand the importance of being vaccinated. I do think young people also understand their role in making sure that their loved ones are safe. They're thinking about their parents and their grandparents. They want to be social and they want to get back to what we say, what a new norm. So they understand that it's important. So we've seen young people really embrace being vaccinated. Probably the biggest side effect is no different from even the adults, is that soreness in the arm. And we've also seen, I think, that in the first 24 hours, many will say that they just feel kind of run down for that first day or so, and then they're back to themselves.
Sounds like my experience. Is real-time data proving that the vaccines have better efficacy than during the trials?
So I'll take that. So, it's a difficult question because it's hard to show you're doing better than 95-ish% efficacy, right? There's not a lot of room to improve on there. But what we're finding is that the vaccines are having, at least 95%. It kind of goes to a little bit of how you measure it, but the bottom line is they're highly, highly effective, whether you're looking at Moderna, Pfizer, or Johnson & Johnson. So I would say they're at least as good, if not better, than what we thought from the trials.
A related question. Dr. Fauci said fully vaccinated people may not need a booster shot. Others say we will need booster shots every 6 to 12 months, perhaps as soon as September. You've mentioned we are determining this live as we watch how long antibodies last. What is the latest information? Is there one source that we should trust? Actually, Fauci did an interview yesterday.
I can take that, or we can share. This is interesting because the science is still out there. Scientists are still working very hard trying to get us additional information on what this is going to look like, over the next few months. I will say what we're asking people is to, monitor, get vaccinated. So definitely get vaccinated, and that's important. But if you were to find that you're having symptoms and you're not quite sure, what those symptoms might mean, we still want you to see your provider. We still want testing to be it's important to still get tested, because what that's going to do is allow us to know, for instance, in those post-vaccinated people, if you are at risk of having gotten the virus after a certain amount of time, then what does that time interval look like for sort of that exposure? So scientists want to know that information, but we're not going to be able to know those answers if we don't ask the questions, gather more data, and really stay on top of what testing will look like on those individuals who've been vaccinated. And then there's some who've been infected who, I'm sorry, Dr. Purse, there's some individuals who've had the infection. And so we also want to know what does that look like from having natural infection. So again, symptomatology later in the year, we are still asking that there's still viability in having testing and actually getting and seeking out being tested.
Yeah, I'm sorry, Dr. White, I didn't mean to interrupt you. But I did have something to add, and your last comment segues perfectly into what my thought was. So I did not see Dr. Fauci's interviews yesterday, so I don't know specifically what we talked about. But to this point, there is an interesting, there are two recent articles that are undergoing peer review right now, and they both found basically the same thing, which is a bit of a surprise. And that is that the people who were infected and then afterwards became vaccinated are having very, very high levels of protection. And in fact, their levels are so high that it is being speculated that they may have very, very long immunity post-vaccination, whereas people who got vaccinated are also having a very robust response, but they're starting to see that level of protection drop off a little bit faster. And so the thought is that the people who were never infected but got 2 doses, they may need a 3rd dose at some point. So in essence, if those who were infected once and then got 2 doses, they've basically gotten 3 exposures, 3 opportunities for the immune system to respond. And so it may be that you need 3, whether it's 1 infection and 2 shots, or and you know, when I say 2 shots, I guess with J&J it could be 1, although the studies only looked at the 2-shot regimen, or you get 3 shots. But either way, it may be that you need 3 exposures to get what maybe they're projecting, and we won't know we won't know until time passes. But the levels of protection are so high that they may last for years. Have to wait and see, though.
A rare heart inflammation has been seen in vaccinated teens and adults within 4 days of the 2nd dose. It appears most common in males. There were 18 cases just announced in Connecticut. Is this something to watch or too rare?
So I'll take a first stab at that, but I invite Dr. White to join in because I know some of this, but I don't want to say that I'm totally on top of it. The most recent thing that I saw was that there is still debate as to whether or not this is necessarily related to the vaccine. But in the cases that are speculated to be related to the vaccine, they appear to be very short-lived and people had complete resolution. Now that's what I know, but Dr. White, you may know something more current or more in-depth than I do on that.
And you're right, Dr. Purse. That's exactly the information I've read about as well. The concern is, again, one of the things we're excited about, right, with the vaccine and the way we're doing our evaluation and doing the reports is that we're very early looking at anything that might be an outlier from a safety data perspective. So that's exciting to hear that there's a safety concern. They're quickly looking at it, CDC, and everyone's kind of hunkering down and saying, okay, is this a unique situation? We know the viral myocarditis in kids does happen. And I think for some people in the community, you just don't know how often it happens because you don't really hear about it unless maybe it pertains directly to you. But they also have identified that if in this group of patients, the symptoms were very mild, short-lived. Hospitalization was really a short hospitalization. And most of those children did fairly well, unlike children who get myocarditis from other viruses or actually get COVID and then get the myocarditis, that inflammation of the muscle, who end up having a much more prolonged hospitalization, much more severe disease.
Yeah.
So
I think that's worth repeating. I think that's really worth what you just said. I think is really important for people to understand that if you get myocarditis from COVID, that is a much more difficult course of illness and some have got permanent problems.
Yes.
And so again, you know, we don't live in a risk-free environment. You got to choose which risk you're willing to take, and I will take the vaccine any day over the virus.
When getting vaccinated, should you stop autoimmune medications?
right, so I'll jump on that one. And I think that one of the things that we've been saying all along, so if you're on an autoimmune medication, you're on it for a very good reason. And so while the autoimmune medications may dampen your immune system response to the vaccine, the lesser of the two evils is to stay on your autoimmune medication and hope for the best with how much of a reaction you get to the vaccine. But I would not recommend stopping your autoimmune medications. Now, you should have a conversation with your prescribing physician. Depending on your specific situation, he or she may say, you know what, your situation is so bad, you need to have that conversation. But as a rule of thumb, I would not stop your autoimmune medications because you're on it for a very good reason.
And
sometimes the key to that is, go ahead, Janine.
No, I was going to say, I was going to add a fair number of my colleagues who are actually practicing medicine, actually at MD Anderson and other institutions, particularly patients with oncology concerns. And to that point, what Dr. Peirce is mentioning, the coverage of being, again, you're having your conversation with your provider, but even with maybe a weakened immune system, having that vaccine coverage is still giving you a level of protection of that virus, COVID vaccine virus, we know how seriously ill a person can get, is still the right reason to not get the infection. So you may have a dampened immune system, but you still can mount a response. And that response is showing significant levels of protection than you not having anything at all and getting the virus. So we've had these conversations with, colleagues about those clients that they see. And to Dr. Peirce's point, you really want to have that targeted conversation with your primary provider, your specialist provider, but certainly some level of protection of vaccination is still better than, in essence, no vaccination. We know vaccines are safe.
Can vaccinations get rid of long haul issues?
So I can take that one, Dr. Peirce. We know long haul is really a sign and symptom of being infected with the COVID virus. We've not seen that in those vaccinated and have that same experience. You'll hear this a lot of times, but we'll say we still need more information and more data. But those individuals who've been vaccinated that often then say they've gotten the virus, they're much short-lived experience on their symptomatology, and we've not seen that be a symptom. But certainly science is still asking those questions of those particular patients, but it's the ones who had not been vaccinated, got COVID vaccine, that we're seeing the long hauler in.
This is a pretty interesting question. A large percent of unvaccinated minority adults have a concern about getting time off to recuperate from vaccine. Is there any emergency protection that can rely on to protect their jobs? It sounds like this is inferring that it takes days to recuperate from getting the vaccine if you have symptoms at all. Can y'all talk to the symptoms and the longevity after maybe the first or second shot?
Yeah, so I'll take that. So for the most part, with the post-vaccination symptoms that people get, and we've talked about this, we know that for the great majority of folks, they're pretty mild symptoms. There's a little bit of arm soreness. You may have a low-grade temp for a day, perhaps two, some body aches, but they're not terribly severe and they are generally short-lived. Some other folks are having, prolonged symptoms, and in them, my first question would be, you need to get tested to make sure you didn't get infected, and you're actually having symptoms of infection, which you're blaming on the vaccine, because the vaccine takes generally around 2 weeks to start providing you any level of protection. So if you're having significant symptoms in that first 2-week window after the vaccine, there's reason to be concerned that you're actually infected with either the COVID virus or some other virus. But I'm not hearing, again, I defer to Dr. White, I'm not hearing about people having major problems with post-vaccine symptoms such that you need to take, maybe a day or two off of work. But I'm not hearing about anything greater than that, but I may not be in that loop. So do you know anything, Dr. White?
Right. No, I have not heard of prolonged. I know, to Stephen's also point, the American Rescue Plan has put in some structure around sort of that business model, small businesses, nonprofits who may not have that same capacity. They've added some language so that their staff, their employees who might need that additional day and maybe not quite know if they have that resource from a small business perspective or even from nonprofit financially, that the rescue plan has put some language to help support that you should help your workforce if that were to happen, really how to support them to have that time to just have that convalescent moment of just kind of recovering from having been vaccinated. Even the time to take off
I think,
or the time after.
yeah, absolutely. I think probably an important part of this is that, you know, from certainly a public health and a governmental perspective, we believe that, you know, it is so important for people to take this vaccine in order to protect, you know, life, that, you know, there are accommodations that are being made to support folks doing that. And in my lifetime, I can't remember, you know, that kind of support for any situation. Okay, David, a study looked at the link between COVID vaccine and sudden hearing loss. Any results?
So yeah, so there is a study that looked at it because there were reports of it, and what it found is that the numbers are pretty low, and it appears that the incidence or the frequency, if you will, of sudden hearing loss amongst people who got vaccinated is actually right about the same as you would expect in the general population anyways. So it doesn't appear at this point that there's any increased risk. But again, it goes to the fact that we are so fortunate that we have surveillance systems in place to pick up these rare events, and we're able to take the deep dive. So a lot of this with this hearing loss came from the VAERS reporting system, vaccine adverse event reporting system, which is a good thing in that anybody can report. That's the upside. The downside is that it's totally dependent on the amount of information people put into it. So some of these reports have very little information. So that means that the CDC then has to go back and try and track folks down and get the details. So it takes a little bit longer to sort things out. But at this point, the hearing loss appears to be consistent with what we would have expected people to have, or the population to experience otherwise, even without the vaccine. So, but, you know, this ain't over yet, right? So there will be, I fully anticipate there will be other problems that are going to come up that we're going to take the deep dive in and find out that either they are or they are not what would have been otherwise expected.
Okay. There was a news alert about a digital day of action searching for vaccine sites via vaccines.gov and text zip codes to GetVax 438829. There were also free rides to vaccine locations. Do we have a more comprehensive method in Houston? Do we have this day of action here locally, or is it coming up? I can answer the question about the rides. We do have support for people who actually need transportation, and I think that's also true for the county too. Also remember that there, in certain circumstances, we do offer at-home vaccinations.
And I'll take the day of action only to say, I think that's an amazing idea. I think one of the things that we're learning in this whole experience of the pandemic and working with the community is to hear the community's voice and to hear that those kind of ideals, you know, really at the ground, grassroots levels, at the ground roots, at working as partners, that those are really great opportunities to see how else we can best support getting vaccines in arms. And so keep those ideals, I think keep those ideals coming, stay connected in the conversation, work with your public health department, work with your local legal officials to really say, okay, what works best in your community? What do you think is going to be the best tactic, technique, resource needs to make sure that we get vaccine in arms? So I think that's the, I'm taking notes now, saying how to do a day of action. I love it.
I know this isn't your area of responsibility. You'll be surprised. We might have an answer for this, but inquiring minds are curious. Olympics in Japan, the State Department just warned about traveling there. What's your guess? Should they or will they hold the games? Las Vegas is awaiting your decision.
All right, so I'll take a stab at that because we're actually working with the U.S. Olympic Committee, actually the International Olympic Committee, to help get athletes vaccinated. And you know, for right now, it's game on. Okay, and now the situation in Japan is, you know, has our attention, but my understanding is that the Olympic Games are going to be heavily free of fans. It's going to be mostly the athletes and their trainers and the teams themselves, and so I don't know if it's going to be completely without fans, but they're, greatly mitigating the number of fans that are going to be, not mitigating, but limiting the number of fans that'll be in attendance. So kind of in a bubble. And if they can do that, they're confident that they can pull that off, then I think we will have the Olympic Games. So if, in Vegas, I'd say game on. Plus, it's so late right now. Can you imagine oh my gosh, turning off the Olympics now at this late date? Wow.
So Dr. Purse,
Not gonna happen.
I was going to say, Dr. Purse, I'll add, I think about the sacrifice that the young people or the athletes have made. For many of them, 4 to 6 years to get to that level. And so I'll go to Vegas with you.
Several publications report people on immunosuppressants may have a lower, weaker response to COVID vaccine in some cases. No response at all. Might they need an additional dose to get antibodies? Should they get tested? That's related to the earlier question.
Well, so I'll jump on that because it does go pretty much to the question that we had earlier. And again, the answer is you need to talk with your prescribing physician who puts you on the immunosuppressants, because nobody's situation is exactly the same as yours. And in addition, while a lot of the folks who are immunosuppressants are getting decent responses, you probably you might want to talk to your physician about measuring what your response is. Again, it's going to be an individual decision made by you and your doctor.
I've recently heard of a number of people vomiting. So on went my mask again. Is some type of severe virus going around?
So I'll take that one. There's always something going around in the sense that regular viruses and bacteria, routine illnesses are still happening amidst COVID, amidst the pandemic. So what we're encouraging, no different in school settings, in nursing home settings, in your own home setting, is good hand washing, soap and water, 20 seconds. Alcohol is we've talked about using hand sanitizer, but it doesn't take the place of good soap and water and hand washing for those routine bacterial and viral infections that we still know give us common symptoms of diarrheal illnesses and cough and flu-like symptoms. So those things still are happening.
Let me add a little fun fact to that, because Dr. White is exactly right. But one thing that we noticed is that this year we basically didn't have a flu season. There was almost no flu at all, whether locally or across the United States. But what we are starting to see in the pediatric population are those springtime viruses that we didn't see much of last year. Guess what? We're starting to see them again. And the reason is because people are returning to their normal behaviors. Schools are up. A lot of kids are going back to school now, even though it's the end of the school year. But the after-school activities are happening. Kids are coming together. And so those usual viruses that we see this time of year amongst kids, they're starting to show up in the hospitals just like they would have on any other regular year. So we're not seeing the flu because we're probably past flu season. And maybe that's why we're not seeing the flu pick up here at this late date. And coronavirus keeps going down, but everything else is coming back to normal. As society goes back to normal, so will the viruses.
If fully vaccinated, you can remove your mask, but what about if you're undergoing dialysis, having chemo treatments, have diabetes, or other autoimmune diseases? I'm trying to encourage a friend to keep her mask on.
I can take that one. I mean, while the mask mandate has changed some of the trajectory, that person's asking about a vulnerable population that pre-COVID would still have to think about catching something that's a respiratory illness, still having a weakened immune system, still being in an environment that you're not sure what the person next to you may or may not have as a communicable infection. So when someone still has an immune system that finds themselves at risk, like you said, a person who has dialysis, I think the best practice has always been that those patients still need to be mindful of those safeguards that they had in place to ensure that they felt like their immune system, their safety was still protected. So those individuals that have immune system concerns, particularly like you said, a dialysis patient, it's not wrong to still want to put those safeguards in place. So wearing a mask certainly would be something that they would have done routinely prior, that they can continue to do that.
Very disappointed that the World Health Organization is not doing more to unite countries of the world. Who is taking a leadership role in vaccine distribution in the U.S.? It appears no one, including the CDC, is in charge. That's kind of hard to understand because there is a distribution plan, I think, for vaccine in the U.S. What we're experiencing now is a low uptake of vaccine.
I would agree, Stephen. I think the state's really been working on for Texas, at least our distribution plan. They've been, working closely with the public health officials. We've had great collaboration and partnership. So to your point, I'm not quite sure I can answer that question the way, I'm not sure, if I'm missing the mark on what they were trying to ask in that question.
So let me chime in. I'm gonna add my 2 cents on this. So one is that, it asked about the World Health Organization. They're disappointed they're not doing more to unite countries of the world. So, this makes me sort of think a little bit, and Dr. White, you guys dealt so much with the schools, but it makes me think about the schools a little bit, because the World Health Organization can serve in the role of the matchmaker and try and get, countries to talk to each other, those that have vaccine, those who need vaccine. But at the end of the day, they don't have authority over the countries and what they do with their vaccines. They're still independent nations. Kind of like with our school districts, we tried to bring them together and we had lots of conversations and we educated folks. And kind of, to some degree, I think we kind of hoped that they would all function the same way. But at the end of the day, they're independent school districts, and they and their boards made up their own decisions. And so there was some discrepancies and some differences, I should say, between one school district and maybe even a neighboring one, and how they handled things like masks and social distancing and so on and so forth. So I think the same situation at the world level is the WHO is the matchmaker, but really has no ability to compel countries to do anything.
Great.
Okay, I'm gonna go really fast on these last couple of questions because we're running out of time. Do breakthrough cases ever result in severe symptoms, or mostly not at all?
Well, I'll take. Yeah.
Okay.
So the answer is that yes. While the percentage is very, very low, some people who are breakthrough cases have gotten very ill, hospitalized. We've actually had some deaths. The risk is really, really low, but it is not zero.
There's now a commercially available T-cell test. Is this of any value?
I think that I think the science is saying it's a value, but where it plays in this whole game of COVID pandemic and where we're headed to in the next couple months and next years, the science is still out, but it has value.
Okay, 40% of race data is missing from CDC database. Does that come from the state health departments? And is this accurate in Texas? We're experiencing the same thing, but that information is going down because it's now being required.
Right.
That percentage is going down because it's now being required. The last question. Women with PCOS may have a higher chance of getting COVID, and PCOS could hide some of the symptoms of COVID. True or not? They say it came from CNN. David is raising his hands, which means that we don't know.
I don't know. I'm not on top of that one.
We'll know the next time because we'll look it up. Well, I want to thank Dr. Janita White for joining us for this COVID talk with local health authorities. Sorry for the slow start. I'm actually in the Harris County offices because of traffic issues. With us was also Dr. David Pearce, representing the city of Houston, our producer, Morgan Ash, who helped to pull it together and make sure I got connected. And special thanks to Kathy Finninger, past president of Rotary Club of Houston, who actually provides us with the questions. I'm Stephen Williams, director of the City Health Department. See you next week.